Whether you have pain in your back or joints, surgery may not be the answer. Instead of the dangers involved in cutting out tissue, consider healing and rejuvenating the area with stem cells, platelet-rich plasma, or prolotherapy. The treatments that are available to professional athletes are now available for you. Watch the videos at jointrehab.com or call the Darrow Wellness Institute at 800-300-9300. 800-300-9300. That's 800-300-9300.
Welcome back to Living Pain-Free with Dr. Marc Darrow. We're taking your calls at 866-870-5752 so you can get your free book, Dr. Darrow's latest, Stem Cell and Platelet Therapy, Regenerate, Don't Operate. That's 866-870-5752.
So I'm going to get to Jeff in just 1 second. Don't go away, Jeff. This is all about regenerative medicine, regrowing tissue, getting rid of musculoskeletal pain. We also do something in the office that's pretty unique. It's called the vampire facelift, where we inject the face with your platelets or stem cells and regrow the collagen in the face to make you young again, which is amazing. And also for people that have a little hair on their head that's thinning out, we can put the same cells into your head and rejuvenate the follicles and feed them with your own cells and get some more hair growing. I had a brain lapse before on that biphosphonate medicine. I mentioned Actonel, which also causes fractures, although it's supposed to grow backbone. And Fosamax is the one I blocked out. And thank you, Marianne Delaney, for texting me to remind me.
Oh, Marianne. Hi, Marianne.
Yeah, Marianne, we love you so
much.
much.
We love you. We haven't talked to you in a long time. You should call the show.
Glad you're listening to the show. Yeah, she's one of my best patients I ever had. She had a complete makeover when she came in to see me. It was pretty amazing. So the biphosphonate medicines, I say stay away from them. They're not good for osteoporosis. If you have osteoporosis, you're getting older, or you're on the way. Some people say, I only have osteopenia. Well, that's not any great thing to say. It means you're losing bone. Osteoporosis is just further along in the process. It means you're on the way to osteoporosis. So, Jeff, you've got a son that has a torn disc in your spine. Tell me about him. How old is he?
Okay, he has Down syndrome, I guess, which may affect his spine some, and also autism. He's 26 years old.
Okay.
He noticed it after COVID started because he'd been doing a lot of exercise before, but he was just sitting around the house.
Yeah.
And then all of a sudden he started to bend over and have a lot of pain when he was walking.
Sure.
And bending and sitting and stuff. And they say that the discs are torn, I think L2 to L6, and most of the pain's on the lower part of the back. And some of them are protruding into the nerves.
Okay.
And also just because he has very non-communicative, we're really scared to have surgery.
Sure.
He has had a cortisone injection, but we cannot tell if that had any effect at all or not.
Okay. So is he able to speak to you?
Somewhat, but sometimes if you say he's in pain, if he wants you to feel good or he wants to continue the activity, he'll say he doesn't. But we do know that he is in pain, and sometimes people ask him so, and he always points to the lower part of his back.
Okay.
And he says that he's hurting. And if it gets really, really bad, then he'll say, ouch, ouch, ouch.
Yeah.
And there was one time when he lost control of the urine, and he had to go to the emergency room, and they gave him some morphine, and then that seemed to help.
Okay. So one of the things,
lie down.
One of the things with Downs is there can be an association with laxity of the ligaments. Okay. Ligaments hold bones to bones. So if you look up ligaments on Google and you hit images on the upper left-hand corner, you'll see, you can look up like iliolumbar ligaments. Those are in the low backs. And you can look up interspinous ligaments. Those would be the two main things in the low back that may be affecting him by loosening up. And that's something that we can probably help with in terms of strengthening them. When these treatments of using stem cells and platelets are done, the ligaments actually get thicker and stronger. Now, I can't promise anything to anybody ever, okay? And with someone that can't communicate, it's even more difficult to see if it's helping or not. Now, if someone has pain, that's real simple if they can communicate. They say, I feel better.
Well, you can sort of tell because he bends over to the sideways to relieve the pain.
Right.
And also, he'll start to lift, and he starts to like shake his legs, so there may be in like a, what do you call it, a pinched nerve or something along the process for that. And also, he has to constantly hold himself up either against the wall or
Sure.
or the table.
Well,
But
I'm
if
so sorry to hear this, but I would say if you can bring him in, I'd love to examine him. The number to the office is 800-300-9300, 800-300-9300.
Yeah.
You'll get a free copy of my book, Stem Cell and Platelet Therapy, Regenerate, Don't Operate, just for calling in. We'll mail that out to you.
800. Oh, sorry, 300. I have autism myself, so I apologize.
Okay, no problem. I think every smart
300.
person has a little bit of that too.
Oh man, you're the first person that's told me that. I suspected it so much because sometimes it's just when I'm nervous. But anyway, it's 800-300-9300. Now he only has Medi-Cal right now.
Okay.
Is it still something we could work out for at least the next?
You have to call the office and see what the story is on that. Okay, I don't talk.
Yeah, okay. So 800-300-9300.
Yeah, it gets too confusing
also,
to talk about insurance.
Yeah, is anything to be done as far as getting them the disc away from the nerves or anything like that? Or
I'm not sure that's the issue. You have to bring them in. I have to touch the area.
Okay, maybe I'll take a look there.
Yeah. Mm-hmm.
Yeah, we have started physical therapy for him, but thank you so much. And it's just the ligaments in the lower spine.
Well, look them up. See what they look like.
That's what I mean.
Yeah. God bless you.
Just wanted to be...
Yeah, God bless you, and thank you so much.
Thank you for your call, Jeff.
Yeah, Jeff, thank you so much. It's been a pleasure talking to you. God bless your son. And there is some very good hope using regenerative medicine to heal his back pain, even with Down syndrome.
You want to give the phone number as I pick up Lisa?
Yeah, give me a call right now, live and local, right? I hope. 866-870-5752. That's 866-870-5752. I said the live and local for Dr. Gene Steiner, who used to be the host before you were born, Nita.
Oh, yeah, I did. I met him. Yes.
He used to go, we're live and local.
That's hilarious.
You know what? I'm going to give him a call today. He's living, I think, in Sedona, Arizona.
Wow.
Haven't talked to him in a long time.
Well, tell him I said hi. I remember meeting him a couple times.
Yeah, nice man.
Yeah.
So, Lisa, this is Dr. Marc Darrow. Your husband has knees. What's up with his knees?
He just recently saw his primary care physician because he's been experiencing some fairly severe knee pain.
Okay.
He was x-rayed. I actually have a sentence here describing what the diagnosis was from the imaging. I don't know if you want me to read that off. It's just one sentence.
Of course.
Degenerative joint disease with joint space narrowing primarily impacting the medial compartment.
Okay.
He's an extremely active 75-year-old. He actually walks to the gym, which is about a 2-mile jaunt, to get his cardio versus going on a treadmill.
Okay.
And just, I guess he's been told that he has a couple of options. Number one is cortisone, and if it gets worse, then they're talking partial or possible knee replacement.
Okay. So here's my 2 cents on all that. I would never stick cortisone in a knee, and I want you to do this. Look up cortisone and cartilage on Google. Just put those 2 words in. You're going to be pretty shocked what it does to the cartilage. It kills it. Okay? Now, I know it's traditional medicine to do that because most patients that come into me with knee pain have already been to their orthopedic surgeon or primary care doc and had cortisone injections. Some have had so many that there's nothing left. They've created bone on bone. Now, I know they're going to say you can do 3 a year. I wouldn't do any. That's just me. Okay? I've never seen any good come out of it.
He's been told by this same orthopedic that he basically has the knees of a 50-year-old. So he's, like I said, he's in extremely good shape, but just a deterioration. So is stem cells something that is an option for him?
Well, I need to examine him to know for sure. But just based on what you're telling me, he's an excellent candidate. He's got a little bit of cartilage degeneration in the middle parts of his knees. That's called medial, like you just said. And there's a little bit of joint space narrowing, but my God, that doesn't mean you get cortisone in there or do a surgery. That's insane to me.
Okay.
We rebuild it. We rejuvenate it. We have, I could show you photographs before and after. I think there's some in my book, actually. Nita, why don't you go looking while I'm...
I have one more question. Are these typically a single treatment type of procedure, or is it multiple treatment procedure?
That's really hard to say. I've had parts of me I've injected that have healed literally overnight, and some that have taken several treatments.
Okay.
So there's no answer with healing. One answer that the surgeons give is it's going to fix you. And then I get those patients afterwards where they got worse. So there's no promises in medicine. I'm sorry. The only promise you can have is I'll cut your arm off and you won't have an arm. You know what I mean?
But you don't do that.
No.
Well, thank you so much. I appreciate the input.
When you get the book, Lisa, you'll see on page 52 is Anatomy of the Knee Joint, and it goes into much detail. So it will help you.
There's a lot. Yeah, there's a lot here. Page 37, I'm looking now, shows a knee replacement. And I just wanted to mention Terry McNally because he was. I met him. I was on his show at KPFK, where you have a show, Anita.
Yeah, and you were on my show too.
Yeah, and he had excruciating, painful knee, and he showed me an X-ray, and the femur bone, the thigh bone, wasn't even sitting on the tibia; it was off to the side, and the reason for that is he had a surgery that removed the meniscus, and it came out bad, real bad, and he came in for a series of injections. And he was back to hiking, dancing, doing yoga, pain-free. I haven't talked to him in a few years, so I don't know how he's doing now. But at the time, he was doing real well. Actually, I'm going to give him a call today, too. This is Call People Day.
That's good.
Terry is a really great guy. Yeah, I'm writing his name down right now to give him a call after the show. So anyway, it sounds to me... Lisa, like your husband would do really well with these regenerative medicine treatments, platelets or stem cells. And again, I have to examine him first. I don't diagnose people over the radio. And I never diagnose people based on what other doctors say because they're usually wrong. Why are they wrong? Because they follow traditional medicine, which is very invasive, gives medicines, gives cortisone, gives surgeries when it's not necessary. I'm a natural medicine guy, okay? I don't like what they do. I like the doctors. They're very smart. And I love orthopedic surgeons because that's really hard to do. But I don't like the work that they do, if that makes sense. Most of the stuff that I see is an abomination. It's not the surgeon's fault. It's just what happens. When you take tissue out, you destabilize the area. And then you're setting yourself up for another surgery next time you have a little injury or overuse. Is your husband still walking 2 miles?
Oh, yeah.
Yeah, well, he
throws on 3 or 4 knee braces and just powers through it.
Yeah, please do not let him get a cortisone shot, and please do not let him get a half knee replacement or whatever they're talking about. To me, that's like when you want to kill a mosquito, you get a cannon and try to shoot a cannonball at a mosquito. It's just ridiculous. There's so much damage that's done. Any other questions, Lisa?
No, I think you've answered it all. I've got your website up here, so I'm taking a peek at it right now. But I do appreciate all the input. I'm definitely going to show him all of this, and he's actually at the gym right now. So
yeah, he's not that bad off. I can promise you that. The people I have concern about are people whose joints are so destroyed they have no range of motion.
He uses
just
it,
in pain.
He
just has pain.
Pay the price with it. That's all.
Yeah, he just has pain. He may have a meniscal tear or something like that. You can't see that on an X-ray, but if he gets an MRI, you might find a meniscal tear. Big deal. It's nothing. Okay.
Yeah. Excellent. All right. Thank you so much.
God bless you. And we're going to send you out a free copy of my book, Stem Cell and Platelet Therapy, Regenerate, don't operate. We'll get your address. We'll give you a call and see if we can make your husband happy. Yeah, thank you.
Thank you so much.
Thanks for your call, Lisa.
I'm going to give out the studio phone number right now so you can talk to me live. It's 866-870-5752. I love when people call me and stump me. The harder the question, the more I like it. And if you don't get to me during the show, you can write down this number. It's to my office and get a hold of me there. It's 800-300-9300. So, the work I do is still not accepted generally. It's a movement that's been going on. I've been doing it 25 years or so, and more doctors are doing it, but it doesn't make a lot of money for the medical community. And I always tell people, if they want to know the answer to any question, I say follow the money. And the big money in medicine is in medicines and in surgery. And that's unfortunate because that drives doctors to do things that I think they shouldn't be doing. That's just my personal opinion. I'm not the god of medicine, and I know if a lot of people are listening who are in the medical field, they can totally disagree with me. But the nice thing with my work is I'm not hurting people, okay? And I'm getting a lot of people better. If you go to yelp.com, YELP.com, and put my name in, Marc Darrow, MD, in Los Angeles, you're going to see, I don't know how many good Yelps. There's a few bad ones because some people don't like me and they don't like what I have to tell them. And there's a few brats out there that like to just give bad reviews to everybody. So, but I'd take a look if I were you, see what people say. What do you think, Nita?
I think that's brilliant, and I think that people ought to call you at 866-870-5752 and get your free book.
Nita, do you know why I gave away my dead batteries?
Because they were dead.
No, they were free of charge. I love your little laugh, Nita.
That's a good one. I like it.
Okay, I got another one. This one's hard. Put on your thinking cap and your big IQ.
I may have left it in the car, but go ahead.
What do you call it when one cow spies on another? A stakeout.
Oh, I should have known that one.
By the way, I want to give a shout out to Wood Ranch. Have you ever been there, Nita?
Oh, barbecue. Yeah, I love that place.
I just discovered one kitty corner to my office on Wilshire.
Really?
In West LA. And I was like, God, I never saw that before because Bandera was there before, which was a great restaurant. Oh,
right. That was a big stakeout.
Oh, it was great. So I see it, and I'm curious, so I call up before I go home because I often eat in the car on my way home. I leave late. And I had the best food I've ever had. Their barbecue is amazing. They have beef ribs, pork ribs, great salads, great sides. And since the day I found it, guess how many nights I've been there?
5?
Yep, exactly. In a row.
Okay, I'll meet you down there one of these late afternoons.
You let me know. I will take you out.
Okay.
Yeah.
No, I love their food. That's so funny. Oh, guess what? We have Joseph.
Oh, darn it. I was just going to crack another joke at your expense.
Oh, thank you for calling, Joseph. You saved me from another joke.
Hey, Joseph, Dr. Marc Darrow, your mother's right knee. What's wrong with it?
Well, let me explain. Years ago, I told her, so thank you for your time, by the way. I told her, Mom, you're walking at a 45-degree angle. You're looking down. It's going to get worse. Start to straighten up. At 88 and now 93, it's developed into where I thought it was going. A lot of pressure on the knee. The cortisone shots of 4 years every 6 months are no longer working. She has now submitted herself in the last month, 4 weeks in a row, to chiropractic treatment, but the knee is still not helping. So I talked to Jason just a moment ago, the man at the 300 number. He was very informative. You ought to hire that guy. And I thought maybe you could just throw some mother not really wanting to have listened to me years ago, and what possibilities at 93, coming up 94 on October 4th. What could she do if we just come for one visit? I have a book coming in the mail, thank you. I just think that there's a portion of her that no matter what you do for my mother and others like her, they know more than everybody on the planet. And the result is that she says, oh, everything's good with the chiropractor, Joseph, thank you. It's just my right knee when I get up. Once I get going, I'm okay. But, Mom, are you in pain? Are you in pain? Well, you know, a little. That means...
Joseph, did we lose you?
Let me take it from here.
Okay.
Joseph, for some reason or other, we can't hear you anymore. But I have a lot of information, and I don't need you to tell me anymore right this second, so I'm going to respond. So you made a statement. Your mom had cortisone shots every 6 months for years, and it's no longer working. It's working. It killed all the cartilage in her knee. She never should have done it. Okay? What the working part was, it reduced the pain because it's a very strong anti-inflammatory. So it feels good. It's like winning the battle, and then you lose the whole frickin' war because you end up with a terrible osteoarthritic knee. So I'm not chiding against her doctors because that's traditional medicine. That's what they do. But it's not what I do. It's not what I've ever done. It's not what I'm going to do. All right? So what I would do with your mom is I would bring her in. If it looks like I can help her, I would inject her own cells, platelets, stem cells from her body into the knee and help start it healing up. I do have people in their late 90s. I just had one yesterday. She couldn't hear one word, and she kept saying, I can't hear you. I can't hear you. It was so cute. But I have worked on her knees, and she stopped complaining about knee pain. Yesterday, I did her right shoulder. Okay? So the age is insignificant. I treat kids who are very high athletic level. I get a lot of 12-year-olds, 13-year-olds, high school kids. And then I treat people all along in the ages and people well into their 90s. I've had a few people 100 years old and helped them out also. So there's hope for your mom, but as I always say, I've got to touch the body, do an examination, and see if it's something that I think will help. I do occasionally turn people away if, let's say, a joint is completely fused and I don't think I can help them. And there are cases, though, even with the joint fusion, if a person wants to, we will inject just to reduce some of the pain. Now, what I do is not a painkiller. It's not like a cortisone shot, but it's a painkiller in terms of if we can grow back enough tissue, some of the pain can go away. So I hope that helps you, Joseph. And God bless your mom. At 93, to me, I think she's still young. People think of that traditionally as being old. I do not. My mom made it to 102. My dad died young at 90. I'm laughing when I say that inside. But he had a heart problem, and he just went to sleep. My mom went to sleep, too.
My grandmother made it to 108.
Are you kidding me?
I am not.
Nita, you and I will be dancing when we're 110.
I agree.
I'll take you to the Wood Ranch when you're 110.
Okay. Well, they better still be there. The problem is everything closes up and we still are marching on here.
Oh, my goodness. So I guess I will take another question here. We have a couple more minutes left.
Yes. Go ahead. Go for it. Do you want to give the phone number?
Yeah. Oh, my God.
Oh,
phone number.
Nope, we're out of time.
Okay, but phone number to the office, 800-300-9300. Website, www.lastemcells.com, where you can actually watch videos of me doing these procedures. Nita Valens, I love you. You're an amazing host. Suzette, yes, we love you guys.
Thank you, Alex. Thank you, Suzette. And remember to listen to our pal Warren Eckstein, 11 to 1 every Saturday, and we'll see you next time.
You've been listening to Living Pain-Free with Dr. Marc Darrow. Now that you've heard Dr. Darrow, you can schedule an appointment to talk with him in person by calling his office anytime at 800-300-9300. That's 800-300-9300. Or go online to lastemcells.com. Again, the website is lastemcells.com. Living Pain-Free with Dr. Marc Darrow is heard every Saturday at 10 a.m. and 1 p.m. here on AM 870 The Answer. Remember, to take the first step toward a pain-free life, schedule an appointment by calling 800-300-9300. That's 800-300-9300. Live long and pain-free. And thanks for joining us today.